Fluoride, that's a big word. That's the F word in dental care, as far as I'm concerned. It's the F word. So fluoride should not be in your body. It's a toxin, like you talked about. That's probably one of the main reasons I'm so against fluoride. The only way a baby is born with fluoride in their body is if mom has fluoride in her body. So when you think about it like that, it's knowing all the harmful things it does, why would we want to put that in our products, in our mouth, in our body on purpose? Fluoride even at lower doses can be absorbed into the bone. It's fluorosis of the bone, which basically means it's a weakened part of the bone. What fluoride does in the tooth is it will actually kick out a mineral and replace it with fluoride. So it's actually going to get into your hydroxyapatite, possibly even into the layer beneath, which is your dentin. Once it gets into your dentin area, because it can get in there, especially if you have pits that are deeper, it will kick out some of the minerals in the dentin. The dentin has some minerals. It's fluid filled, has some minerals, but it's protective of your pulp, which has your blood vessel for the tooth and your nerves. So if fluoride is a neurotoxin, and it gets into your bloodstream, it can cause problems, not just in your neurological system, but everywhere. And this is one of the other ways that it can get in, is right here at inside your tooth. What they did find, and this research was buried, the original study that they did was a short study that showed that fluoride works. Fluoride makes your teeth, and the whole idea behind it was fluoride was supposed to be harder than your teeth, so it would make your teeth stronger. But the initial research that they did, which was a really tiny study, came out and said, yeah, fluoride works. It makes your teeth stronger. The longer they did the research, the more they found that's not true. And when they found that it wasn't true, they pretty much buried the research. Never told anybody. They never let anybody know. And they buried the research so you wouldn't know that fluoride doesn't work. So that's my take on fluoride. You don't need it.
Hey, this is Ari. I hope you enjoyed this video. And one more thing before you go. Actually, two more things. One is, if you enjoyed this particular little clip, the link to the full-length podcast is in the description down below. So make sure to check that out. Also, one more thing. Let me ask you a question. What if I could show you how to double your energy levels and dramatically improve your brain function, reducing your anxiety and depression to a degree on par with antidepressant drugs, but without the side effects? Sound pretty interesting? Well, there are, in fact, numerous compounds that can do this, that have been shown to do this. And I'll take you through just a few of these very briefly. One of them is rhodiola rosea. And this has been shown in studies, rhodiola rosea extract, in people with stress-related fatigue and exhaustion to cut their levels of fatigue and brain fog in half in less than a month. Just this one compound. There's another compound in my formula Energenesis called NT factor phospholipids that's been shown to help repair mitochondrial membranes and mitochondrial health to the level of healthy 29-year-olds, taking people with deteriorated mitochondria who are over the age of 65, restoring it to the level of healthy 29-year-olds. And that has been shown in numerous studies in various types of chronic fatigue, aging-associated chronic fatigue, obesity-related chronic fatigue syndrome, to increase energy levels by 30 to 45% in the span of 4 to 12 weeks, depending on the specific study. So dramatic improvements in a very, very short period of time. Two more compounds that are amazing, I highly recommend, that are in my formula Ultra Brain, along with rhodiola rosea. Saffron extract. This has been shown to increase levels of, improve your mood, I should say, and decrease levels of depression on par with fluoxetine, which is Prozac. And not only that, but with fewer side effects. It's much safer and much less likely to cause negative effects than antidepressant drugs are. Acetyl L-carnitine is another compound that's been shown to dramatically improve brain health in older adults. It also improve energy levels in older adults with chronic fatigue by between 40 to 50% in just the span of 2 to 4 months. And the last thing I'll mention here is acetyl L-carnitine has also been compared to antidepressant drugs and been shown, like saffron, to be as effective as antidepressant drugs in combating depression, but without the harmful side effects that so often occur with the drugs. This is just a small sampling of the over 35 compounds that are in my formulas, Energenesis and UltraBrain, that are all proven to dramatically improve energy levels, mitochondrial health, and brain health, and much, much more. And I highly recommend that you go check these out. If you're struggling with depression or anxiety or brain fog, if you're struggling with stress-related exhaustion and burnout, if you're struggling with chronic fatigue, go check out these formulas, give them a shot. I promise you are going to be blown away by the results. And like I said, the science has already proven that these things work. So you don't have to just take my word for it. There's lots of research to support that, and I'll even link to some of that research down below so you can verify everything that I just said for yourself. So the links to those studies will be in the description for this video down below. So check them out. Check out the formulas on theenergyblueprint.com. Again, Energenesis is the mitochondrial formula, and UltraBrain is our brain formula. Check them out, try them out, and I think you're going to be blown away by the results. Thanks so much, and I'll talk to you again soon.